Expecting just one call. Beard Foundation, this is Jim Montgomery. May I help you?
It's deadline week for grant applications at the Carolyn W. and Charles T. Beard Family Foundation.
You give your history. Yeah. Okay.
In 2011, the Beard Family Foundation received 74 applications for funding. The foundation is one of the 5 biggest in North Louisiana. Susan Beard is the organization's president. Her father, Dr. Charles Beard, started the foundation in December of 1960.
Daddy was basically giving back to the community from which the money had come to the company. And so that was his whole sense, was that a company shouldn't operate in a local community without giving back in some way.
When people set up a foundation, they are in effect giving that money to the public. So, despite the fact that it is the Beard Family Foundation, the Beard family does not own this foundation, does not own this money. That money is set there for the public good.
This foundation began as a charitable arm of the Beard Poulon Corporation. When the company was sold, the foundation became an umbrella for the philanthropic efforts of the Beard family. In 50 years of operation, this foundation has awarded grants totaling close to $9 million inflation-adjusted dollars.
It's not as easy to give away money responsibly as you might think. I mean, the key there is responsibly. You don't just stand there willy-nilly and throw $1,000 bills out the window. You've got to be relatively assured that the organizations with whom you are working are in fact working to do what they say they will do.
Important because the money is an investment in the community, and it helps when the community is large enough to sustain healthy operations. Caddo holds 31% of North Louisiana's population, more than any other part of the region.
The larger area, and so there's more capital asset, and that's what usually makes a difference.
The difference shows up in the census data. According to the latest numbers, households in Caddo and next door in Bossier Parish bring home more money per year in North Louisiana, and that means there is more money available to enrich the community in very specific ways. Close to 1,400 nonprofits have been established in Caddo Parish. They cover a wide range of interests. Some nonprofits, religious, educational, social welfare, or recreational, can only survive with funding from other nonprofits, like the Beard Foundation.
We've worked with Gingerbread House, which deals with abused children. Food Bank of North Louisiana, Providence House is a big one for us. Sci-Port Green, improving the environment, because it started out little bitty and it's gotten bigger and bigger and bigger, and in the last 5 years it's really gotten big. And so to the point that we're now giving away anywhere from $800,000 to $900,000 a year in grants.
The benefits of investing all that money in the community are many.
As Daddy always said, because it's so much fun.
This exhibit is called The Science of Generosity.
Jennifer McMenamin is the Director of Development and Marketing at Sci-Port, Louisiana Science Center. With backing from the Community Foundation, Sci-Port developed an exhibit on an ongoing research project at Notre Dame.
What this exhibit does show is some of the physiological effects, some of what areas of the brain giving effects. What the exhibit is going to do, because the initiative is so new at Notre Dame, this is just the start of the second school year for them that this initiative has been taking place. As long as the exhibit is here, they're going to be able to update their research on one of the panels of the exhibit, and we'll be able to participate. So visitors that are coming to Sci-Port will be able to provide feedback to Notre Dame. So at some point you might be able to see Sci-Port as a participant, in a scientific journal, asking questions on a study like, how does giving make you feel?
The fact that a facility like Sci-Port exists in a city the size of Shreveport is a direct result of local philanthropy.
To have something this size and this caliber here in this community really did take a big vision and the dollars to match it. Sci-Port is the 8th best science center in the nation. We are the only one in the South and the only one in a mid-sized city. The others are, in Philadelphia, in Columbus, Ohio, San Francisco, Los Angeles. They are in, these cities that have huge international tourist bases.
Sci-Port, like many nonprofits, has had to adjust how it does business over the years. At one time, the Science Center had roughly 3 equal sources of income: donations or grants, state and local governments, and earned revenue. For example, money spent on admission or at the gift shop.
Some of the government funding has changed, the availability of some of those funds. So what we've had to do is make sure that we have increased our ability to make earned revenue. So we've done that. We changed our business model. So we bring in more earned revenue now. So we're looking more at 60% of earned revenue. And we rely a lot more on donations, and particularly through grant writing. Whenever you tell somebody you work at Sci-Port, the first thing they say is, "Oh, I love Sci-Port." I mean, nobody ever says, "Oh, that must be a terrible place to work." So at the same time, everybody just also assumes that you must be doing fantastic. Look at your beautiful building. Look at all the children that you have in the building on field trips. So things must be fantastic down there. And they are fantastic here. It's a fabulous place to work, but we work hard for every dollar that we bring in the building, whether it's an earned dollar or a dollar that we get through a donation. And it never stops. We never rest.
If you wonder what those dollars at Sci-Port do for the community,
Sci-Port wears a lot of hats. We are a benefit to economic development. We bring in people from out of state year round. We see 60,000 plus school children a year. We offer a lot of admissions assistance to those school children. So we don't let, your ability or inability to pay be a barrier to getting a unique hands-on learning experience. And related to both of those is the workforce development that comes along with education. So it's not just a great place to have your birthday party on a Saturday. All of the programs that we do here directly correlate to state and national curriculum standards. We have teachers on loan to us and paid for by the Caddo Parish School System, the Bossier Parish School System, and part-time from the DeSoto Parish School System. So, everything we do directly relates back to what those 3 school systems are doing in those classrooms. We have analyzed test scores for students that come to Sci-Port regularly. We can show that students who come more often than those who don't, their test scores are higher. We can show that the students who come more often, their test scores have gone up prior to the time when they didn't come. So, we've got some numbers to back that up. So we know what we do works.
And the Beards believe that. Over the years, Sci-Port has received $47,000 in grants from the Beard Family Foundation. Of course, the foundation takes pride in helping many unique organizations.
What we're especially interested in are those programs that are small, local, innovative, and even unpopular. And that has led us down some interesting paths and some very rewarding paths. In the mid to late 1980s, of course, came this new health crisis that no one was quite sure of, something called HIV/AIDS. And it hit with vengeance.
I'd say 21 years ago, give or take, I got sick.
Paul Weiss has been a testing counselor at the Philadelphia Center in Shreveport for 16 years. He tested positive for HIV not long after the Philadelphia Center was organized.
My mother, God rest her soul, anytime I got sick, she was there. She was sitting beside me when the doctor didn't tell me that I was positive. He was describing medications. I looked at my mom, told her, said, "I know what's wrong." She said, "What?" I said, "I'm sick." I said, "I'm really sick."
And it's now been around for 25, 30 years, so people don't remember quite what things were like in those early days, but it was as hush-hush and verboten a thing as you could ever deal with.
It's still taboo. It always will be, unfortunately. I found out on a Thursday that I was positive, and the following Monday, ended up in the hospital for 31 days. I had 104.2 temperature, and I was shaking so hard from being so cold that they admitted me to the hospital immediately. So I was already a foot and a half into the grave. And my family was trying to find all kinds of services. And literally the doors had been shut on my mother and my sister's face. Because I couldn't get out and do anything because I was in the hospital fighting for my life. They were telling my family it was time to find out what to do with me because I was not going to make it.
Brett Malone, Executive Director of the Philadelphia Center.
You know, our mission kind of has three parts to it. One being increasing awareness of HIV and AIDS in our community, how it's transmitted, you know, and then two, working on trying to reduce the transmission rate so that the epidemic can be contained as much as possible. The third part of our mission is to compassionately support people who are impacted by HIV and AIDS. So not only do we provide support services for individuals who are infected with HIV, but also to their family members, significant others.
And they were having a really tough time cracking into the philanthropic circles here because nobody wanted to touch this really touchy subject. And the Beard Foundation waded in with hip boots. In one of the early years when the Philadelphia Center was having a fundraiser, and it came up way short of their goal, something like $25,000 short of what they had hoped to raise. And the very next day, the Beard Foundation board having a meeting, they said, let's make up the difference. And it enabled that organization to stay alive. And as we know, it's a continuing need in the community.
Because the infection rate, unfortunately, in Louisiana is the fourth highest in the nation. And over the years, the demographics have changed significantly to where it used to be almost exclusively a gay white man's disease. At this point, in northwest Louisiana, roughly 80% are African American and 32% are women.
The Philadelphia Center is the epitome of a well-run organization adapting to local needs. HIV testing is free and confidential. Educational programs cater not only to the general public, but to people in the community most at risk. Partnerships with other agencies help HIV-infected inmates reintegrate into society. Caseworkers help each client figure out legal issues, insurance, medical facilities, and if necessary, where to get housing and grocery supports. The center has even adapted to become more accessible to an emerging part of the community. A bilingual caseworker speaks English and Spanish, and the center started English as a second language classes to reach the local Hispanic population.
Even though it's not a direct HIV service, that's how we have to be able to open up our office to a part of the community that doesn't know we even exist. People with HIV and AIDS really have to be aware of, or conscious of, is their own health issues. So nutrition plays a big part of that.
The medication has worn me down to the point to where I have zero body fat. That's why my face looks like this.
And so we're always looking at, the issue of housing, the issue of food, and in this particular field, there's a slogan that says housing equals health care. The truth behind that is that oftentimes medications for people with HIV or AIDS has to be refrigerated.
They can be up to 12 pills 3 times a day, and that's just one medication.
So we do try to prevent utilities from getting cut off, prevent people from, getting kicked out of their homes, because there's that direct relationship between a person's stable housing and their health. So we've had a food pantry probably since day one. We've been around for about 22 years now, and this is just part of it. We have another dry storage area in the office as well, and through our food pantry, we typically provide food assistance for 120 families each month. That's what our average is.
I'm a very proud person. I don't ask for anything unless I desperately need it. And I've had to use the services here on more than one occasion. For a person to be able to do this on their own, you'd have to have $1 million plus a year. And the bulk of that would be medication and doctors.
The programs need funding to be successful, and they rely increasingly on the support of the community instead of the government.
I'm one of the ones, unfortunately, would have to tell a person that they're positive, but I also have to give them condoms. And it's difficult to give up condoms when you don't have them. Because we would get 500,000 to 1 million condoms on the premises at all times. And we're scraping barely with 10,000. That's not a lot of condoms for what we do.
Currently for HIV prevention, there's no direct state dollars, meaning there's not a line item in the state budget that specifies HIV prevention. There was state funds available up until about 2 years ago, and the governor and the legislators started trying to balance the budget as things got worse, and in their infinite wisdom decided that HIV prevention was not a priority, so it was completely removed from the state budget.
And we fight. I've been to the state capitol and got down to the lower lobby where they have their little personal meetings at all the representatives and senators and all that stuff, and we'd be handing out folders to each one of them and pleading with them, please vote for this bill, because without this bill we're not going to survive.
Nonprofits everywhere are learning to cope with this new reality.
Oh, well, we've decided relying on government funding, that's always going to be our lagniappe. That's not going to be something that we count on in the future. We're going to make sure that, we rely on the earned revenue, the grant writing, and the donations, and that the government funding is what we're going to have to view as our extra. There's no lack of love from the government officials. They've all looked at us and said, we believe in what you're doing. We think you're doing great work. We just don't have as much money to give you as we've had in the past.
So we're having to shift from being mostly funded through state and federal sources to mostly funded through private philanthropic sources, really.
Without philanthropy, we would be a much worse off place than we are now. And that's not just our foundation, it's all the foundations here locally.
If the Philadelphia Center was not in existence here, there'd be a lot of people sick and a lot of homeless people.
We wouldn't exist without philanthropy.
I think it makes it a warmer, more caring community, because you're talking about everything from the opera, the symphony, those things that people think about, the Salvation Army, all those great big things. It's everything from that to little not-for-profits that start up that only help 10 people, So I think that all goes together to make a community have a heart.
I think there's also kind of a mistaken belief that philanthropy means you give large sums of money.
Some people just come up and give us $25 just to give it to us. And that $25 can go a lot further than what people think.
And without those donations, we would not be able to keep the doors open.
Somebody asked me today what I did for a living, and I said, well, I'm retired, which I am. And he said, well, what do you do? And I said, well, I am part of a family foundation, and I'm so lucky that I get to spend a lot of time helping other people.